G-rated, but we're going to talk about sex during pregnancy, which is
G-rated.
PG-13.
All right. Let's talk about sex during pregnancy.
That's going to be an interesting challenge. G-rated and sex.
Yeah.
Right.
Well, sex during pregnancy. Yes, absolutely. What do you want to know? There's a lot about not only during pregnancy, but also after pregnancy that affects the way a woman feels about her body, that affects her sexual function, that affects her desire, and also that impacts, obviously, on her partner.
Okay, so first off, should we be doing it? Is it okay for the baby?
Assuming that your doctor is giving you a clean bill of health and you're not in a high-risk pregnancy and there are no complications, sex is not only totally allowed, but good for you when you're pregnant for many reasons.
Can I hand your husband a prescription?
Yeah. Right. Well, listen, I think the men very often, sometimes they're a little queasy about it, and I know Bill is one of those who in theory, although you haven't been through it yet,
I have not.
You're a little anxious about the prospect.
About having sex during pregnancy?
Yes.
No, I'm good. I'm good in that area.
Wait, no, seriously.
Come on.
I'm curious to know what goes through a guy's mind. Like, what do you think you'll be thinking during that period?
That's a good question.
I know what he's going to be thinking.
My mom is watching the show, Victoria.
I want to put it out there. There's a myth, and I think, I'm not going to speak for you, Bill, but I think men think they're going to hurt the baby.
They think they're going to hurt the baby. I've had men tell me that they think the baby will somehow see them in there.
Oh, God.
I mean, there are all sorts of myths. I'm not saying that you think this, but there are all sorts of myths that guys carry around. They're worried they're going to hurt the baby. They also are suddenly seeing their wives like, oh, my gosh, she's a mother. I can't have sex with a mother.
Let me ask you this. At what point do you up till the 9th month, is it okay to...
As long as there's no risk and you're healthy and the pregnancy is healthy, you can do it all the way till the end. There is something in semen that actually at the very end can help, it won't cause premature labor, but it can help bring on labor when you're ready for it to come. So actually, it's good exercise. When a woman has an orgasm, she releases endorphins, which are those feel-good chemicals. The baby benefits from those too.
Yes.
So the baby enjoys it. It's good for your sex life. It's good for your relationship, and it's good for your body, and it's good for the baby to keep that connection going.
I have to say this, that if you're feeling kind of sensitive about your body to begin with, and your husband turns you down,
I know, it's hard. It's hard.
Then I'd be so bummed because you're already getting up the effort to kind of, I can see me maybe not being in the mood, but trying to make an effort. And if he's like going to deny me, I think I'm going to be pretty bummed about it.
Yeah. Most women really, you're absolutely right. It's a sensitive time for women anyway. You got your hormones going crazy. Really throughout pregnancy, it sort of shifts and changes. There are 3 trimesters in pregnancy. So in the first trimester, you just usually will feel horrible. Your hormones are all out of whack. You may have morning sickness. You may feel like you're tired. Your body is literally doing the work, building that placenta for the baby. It is literally like climbing a mountain every day, the physical exertion that it causes inside your body. So a woman is really exhausted. And she also feels just fat, not pregnant. You know what I mean? She feels bloated and uncomfortable. Around the 2nd trimester, she's starting to look pregnant. She's able to get into her maternity clothes. She's feeling good. She's got her energy back. Things have stabilized. That's often when women are starting to feel much more desire. And there's so much pelvic blood flow to the pelvic region that she's walking around with lots of movement down there, so she might...
So does a pregnant woman, because there's the increase in hormones, is their sex drive increased as well?
Not so much, although there have been some studies that have indicated when there's a boy in there and there's more testosterone happening that sometimes her libido is higher, but I don't know. The studies have been so designed on that, so I'm not 100%... I wouldn't want to guarantee that piece of it, but what I would say is that in the 2nd and the 3rd trimesters, you got so much blood flow going down to the genital region that she's like, if the arousal process is 1 to 10, she's walking around in a 4.
Right.
And
that's if you're